y'all on this beautiful, blessed Friday. I want to go ahead and give you some quick assessment tips or hacks or techniques when you're using your stethoscope. Very useful piece of equipment for your assessment, which in turn is going to drive your diagnoses and interventions, right? So this is what you will consider a dual head stethoscope, as it has a diaphragm, which is used to listen or auscultate high-pitched sounds, and on the back, which is the bowl-shaped piece, this is the bell, which is used to listen to lower-pitched sounds such as bruits. Now, the correct way to place the stethoscope, or one of the best ways, rather, to place the stethoscope on the patient is to use your pointer finger and also your middle finger. Place it between the bell and the diaphragm, like that, and place it against the patient's chest, abdomen, or wherever you are listening. That is the best way to do it. Now, the way that you do not want to do it, or the incorrect way to hold your stethoscope, would be to use your thumb and your index finger and place it on the chest, right? Or wherever you're listening again. The thing is, you do not want to place your thumb on the diaphragm because it can cause artifact. And that artifact can travel through the tubing and up to your earpiece. And when you hear that, you think that you're hearing something that is abnormal, such as an abnormal breath sound or an abnormal heart sound, right? So again, you do not want to place your thumb on the diaphragm at all. So this is not a paid promotion by MDF, but this is what I'm using is an MDF. But if someone from MDF happens to watch this video, you want to get with your girl to make something happen, go right ahead. Before I place a stethoscope on a patient, I like to tap on the diaphragm if I'm using a double head stethoscope, right? Because if I tap on the diaphragm, that lets me know, because if I hear anything through the earpiece and if I tap, that lets me know that I'm listening through the diaphragm. If I tap on the diaphragm and I don't hear anything, that lets me know that the bell is the piece that I'm listening through, right? So, because not every stethoscope will have an apparatus to let you know, such as this MDF, because there's a green piece that lets me know that if it's facing forward like this, that lets me know that I'm listening through the diaphragm. If I turn it around like that, I see the green dot here, which lets me know that I'm listening through the bell. But because every dual head stethoscope does not have this apparatus, it's easy to just tap again on the diaphragm, tap lightly on the diaphragm. If I hear anything, that lets me know that I'm listening through the diaphragm, because again, the diaphragm picks up high-pitched sounds. So that is just some little quick exam tips or assessment tips for you. And if the video has been helpful for you in any type of way, if this information has blessed you in any type of way or help you, please feel free to share it with someone else, because sharing is caring. And y'all have a blessed day. Bye.